Hi, my name is Alexis Lopez. I'm a part of Group 12, and our project is on Microbial Diseases of Humans Part 2. Protozoan diseases of the nervous system. Protozoan diseases of the nervous system are infections in the brain, meninges, or the spinal cord. Most protozoa must interact with the blood-brain barrier to cause a nervous system infection. The blood-brain barrier is a network of blood vessels in the brain that allow the exchange of oxygen and water to the brain while preventing harmful molecules from entering. Protozoans have three different strategies to get across the blood-brain barrier: disturbances in tight junctions, means of infected immune cells, or causing injury to the cerebral endothelium, which destroys the blood-brain barrier. Plasmodium falciparum is a protozoan parasite that causes malaria, which is transmitted to humans through a bite from a mosquito. Signaling substances that come from the parasite promote pro-inflammatory cytokines, promoting apoptosis and leading to the disruption of the blood-brain barrier.
Protozoan diseases of the nervous system include Trypanosoma brucei, which is African sleeping sickness. This can be transmitted through flies, typically in sub-Saharan African communities. Some of the signs and symptoms include fever, headache, joint pain, behavioral changes, confusions, and fatigue. The second is Naegleria fowleri. This is primary amoebic meningoencephalitis, which can also be termed as brain-eating amoeba. This can be found in warm, fresh water environments and can enter through nasal passages. Signs and symptoms of this include severe frontal headache, fever, nausea, vomiting, stiff neck, and seizures and confusions. The third is going to be acanthamoeba, which is granulomatous amoebic encephalitis. Signs and symptoms of this include fever, headache, stiff neck, speech difficulties, seizures, and confusions, and can target immunocompromised patients. This usually enters through the skin or the respiratory tract. Some of the other bacteria that we're going to talk about are Toxoplasma gondii, which is toxoplasmosis. Signs and symptoms of this include headache, confusion, poor coordination, seizures, and visual disturbances. This can be from the ingestion of oocysts from contaminated food, soil, or water, most commonly found in uncooked meats. The next is going to be cerebral malaria, which comes from the bacteria Plasmodium falciparum. Some of the signs and symptoms of this include fevers, chills, altered consciousness, coma, and seizures. This can be typically found in mosquitoes and is more deadly than regular malaria. Our last couple bacteria that we are going to talk about are going to be Entamoeba histolytica, which is amoebic dysentery. Transmission occurs through fecal oral routes from contaminated water or poor sanitations. And this usually happens when cysts are injected and they target the colon. Signs and symptoms include diarrhea, gas, severe dysentery, bloody stools, severe pain, and fever. Lastly is going to be the bacteria Giardia lamblia, which is giardiasis. Signs and symptoms of this include severe diarrhea, abdominal cramping, and bloating. This happens when trophozoites attach to the intestinal villi but do not invade tissue. Instead, they interfere with water absorption. Thank you for watching.
Diseases caused by prions. CJD disease is one of the diseases. It is due to the prion infection. It can cause damage to the brain and lead to symptoms of dementia. It is a very quick-acting disease that will rapidly lead to death. This disease is the most common prion disease. Prion diseases are relatively rare in general, but this is the one that you would see the most. The signs and symptoms are ones that would come about because the brain is being attacked by the prions and is rapidly causing atrophy and just damaging the parts of the brain that you need and that are functioning. And so you'll get things like mood changes, not thinking straight, bad memory, loss of vision capabilities, you can't sleep, loss of control of muscle movements, and loss of function with esophageal function in forming words. so you just won't be able to swallow. And a lot of the times, these deaths are just related to not necessarily the prions or like the symptoms that are causing the deaths, but it's just because of your brain shutting down or because you can't swallow, you can't eat. So things like that. And then the second disease is fatal sporadic insomnia. This is one of the rarest ones, and because it is sporadic, it is more common because there are like familial insomnia, which is caused by a group of prions, but this is just a sporadic one. Um, it causes many disturbances to sleep and impairs one's cognitive ability. The signs and symptoms are hallucinations, mood swings, inability to speak, fever, onset of sleep apnea, seizures, atrophy of the brain, and rapidly increasing dementia symptoms. Although this disease does have insomnia in the name, there's not really many symptoms that have to do with obstructed sleep, but it is one because you are losing sleep over it, and those can lead to hallucinations, mood swings, things like that. But a lot of it is again because the prions are attacking the brain, and there are just multiple things that the brain is losing function over, so it will cause these symptoms. And then another disease is variably protease sensitive prionopathy. It causes spongy encephalopathy in the brain and is different from CJD and fatal sporadic insomnia in that there are atypical characteristics of the prion protein. This one is also sensitive to the protease, which is an enzyme, which the other ones are not sensitive to. So this one is more easily classified and diagnosed. The signs and symptoms of this are dementia, so you're going to be losing your ability to remember things, psychosis, loss of balance and dizziness, uncontrolled movements. This is mostly like showing symptoms of like Parkinson's, and then loss of swallowing, inability to verbalize, think of words, or the confusion of words, and then brain tissue atrophy. Again, because prions do target the brain, you will be seeing a lot more atrophy, and MRIs are a really great way to be able to see if you do have a prion-caused disease.
Okay, so I am here to talk about the physiology and treatments of all the diseases caused by prions. First, we have Creutzfeldt-Jakob disease, also known as CJD. In this disease, misfolded prion proteins accumulate quickly throughout the brain, causing widespread neural death. The cortex and basal ganglia are heavily affected, explaining the rapid dementia, coordination loss, and myoclonic jerking. As far as treatment, there is no cure, so supportive care is the only option. Since the neural damage is irreversible, the main focus is comfort and safety, as well as palliative care for the patient. Next, we have sporadic fatal insomnia, also known as SFI. This is unique because it targets the thalamus rather than the entire brain. Damage to this area disrupts circadian rhythm, autonomic stability, thermoregulation, and hormonal control. This is why patients experience unrelenting insomnia, sweating, tachycardia, and weight loss. As far as treatments, they focus more on symptom management. So sleep medications may offer temporary relief early on, but they lose effectiveness as thalamic deterioration progresses. Management may include benzodiazepines for movement issues and supportive regulation of autonomic symptoms such as blood pressure, fluid, and temperature. Lastly, we have VPSPR. This differs from the other prion diseases because its misfolded proteins are only partially resistant to proteases. This slows their buildup and results in more gradual clinical course. The cerebellum is frequently affected, leading to balance issues, slurred speech, and coordination difficulties. And as far as treatment for this, it's also supportive care only. Physical and occupational therapy can prolong independence, and speech therapy may help early on. But any medications are used strictly for symptomatic. There's no therapy that shows that it slows or reverses this disease.
Bacterial STIs, more specifically gonorrhea, is going to be caused by Neisseria gonorrhoeae, which is a gram-negative diplococcus. It affects both adults and newborns. Typically with adults, you find a localized infection at the urethra, cervix, pharynx, or anus. And newborns, you typically find an infection at the eye conjunctiva or the pharynx. And it's an infection that typically only infects humans. And then signs and symptoms, because it's an infection, the symptoms can present either asymptomatically or appear very suddenly. For women, you typically see vaginal discharge, dysuria, which is going to be like a burning sensation typically at the urethra, and pelvic pain. And that most commonly infects the cervix, which leads to cervicitis. And if cervicitis goes undetected, it can infect the upper respiratory tract and lead to pelvic inflammatory disease, or PID. And PID, which can lead to complications such as pelvic pain, infertility, as well as an increased risk of ectopic pregnancy. And then for men, signs and symptoms, you would see penile purulent discharge, dysuria as well, and testicular discomfort. Complications for men, you'd see orchitis epididymis, penile lymphangitis, as well as penile edema and post-infectious urethral structures. And then for treatment and prevention, you'd want to provide dual therapy with about 500 milligrams of ceftriaxone, given typically intramuscularly, but it can also be given intravenously. And then if an individual weighs up more than 150 kilograms, you want to provide a gram of ceftriaxone. And then if it's gonorrhea that has a complication such as PID, you'd also want to include 100 milligrams of oral doxycycline for about 8 days. And then prevention would just be using condoms, and also doing regular testing to ensure that this disinfection does not go unnoticed.
Okay, my name is Jaslyn Castrillo, and I did viral STIs. My STI of choice was human papillomavirus, which is also known as HPV. HPV is a common virus spread from skin to skin contact. Usually sexually, you could get it orally, vaginally, whatever choice of sex. And it's often asymptomatic. Causes are, again, skin to skin contact, sexual activity, or you can even get it by touching the infection itself, whether that's the wart or if a surface has been contaminated, or like a pool or anything. And the virus itself enters the body through broken skin or through cuts. HPV is often asymptomatic, and the most common sign of HPV would be the development of warts. The warts could be near the mouth, anus, or genitals. And treatment and prevention. So prevention is the HPV vaccine that you can get, practicing safe sex with the use of condoms, and screenings. For females, screenings can be done through pap smears that you can get, I think, annually, or whenever an appointment is needed. Treatment. So there's actually no cure for the warts or for the infection itself, but the warts can be treated with creams, cryotherapy, which is the freezing off of the warts, or surgical options. Genders are furtherly affected through the possible development of cancer. In men, oropharyngeal cancer or throat cancer is very prevalent, and they also have a higher prevalence of getting it orally and in their genitals. And for females, they're more susceptible to cervical cancer.
So I was in charge of looking at urinary tract infections, more commonly known as UTIs. UTIs are going to be an infection that take place in any part of the urinary tract, which can include the kidneys, the ureters, the bladder, and the urethra. Urinary tract infections mostly affect females, and they're typically an infection that takes place in the lower half of the urinary tract. Once the infection hits the kidneys, it's a lot more dangerous. The infection is just going to cause a bunch of inflammation to the lining of the urinary tract, which can cause pain when urinating and abnormal urine odor. So urinary tract infections are caused by microorganisms or bacteria that enter through the urethra and go into the bladder and cause an infection. Usually, E. coli bacteria is responsible for UTIs. It's responsible for 90% of all UTIs ever diagnosed. However, other bacteria can cause them as well. The bacteria is going to enter through the urethra just due to insufficient cleaning where bacteria builds up. It can happen during sex or swimming, especially if you're swimming in like a lake where there's a lot of bacteria around. UTIs are more common in females just because the female urethra is a lot easier for bacteria to enter through compared to males just due to the anatomy difference.
We are looking at an extension of urinary tract infections. Signs and symptoms can include a burning feeling while urinating, a strong urge to urinate that typically does not go away, urinating often and passing small amounts of urine, not to be confused with diabetes. Obviously, with extended diagnosing capabilities, they can differentiate between the two. Urine that looks red, bright pink, or cola colored, sorry. That obviously warrants immediate medical attention, signals bleeding in the urinary tract. Very common is pelvic pain. Pain is going to be obviously center of the pelvis, can radiate to the back, overall kidney area, possibly genital region. Diagnosis methods include growing urinary tract culture in a lab. So obviously they can determine what type of bacteria is causing the infection. Creating images of the urinary tract, which would include extensive CT scans, MRIs, occasionally ultrasounds, and using a scope to see inside the bladder. This is a technique that is becoming more popular. They pretty much go inside of the urinary tract and are typically able to pinpoint the area of infection and the
Christian worldview. Every individual was made in God's image with Genesis 1:27 stating, "So God created making in his own image, in the image of God he created them, male and female he created them." Understanding and treating microbial diseases in humans helps honor God by ensuring all patients are treated with the highest quality of care. Treating microbial diseases in humans is an example of following Jesus. According to Matthew 9:35, Jesus went through all the towns and villages, teaching in their synagogues, proclaiming the good news of the kingdom, and healing every disease and sickness. Healthcare providers ensure the correct medication is given to their patients in an attempt to heal their disease or sickness.